Immigrant doctors play a crucial role in the U.S. healthcare system, serving patients in parts of the country where there's a shortage of doctors. These highly qualified medical professionals from Southeast Asia and elsewhere have the same amount of training as American doctors, if not more. They take the same exams as U.S.-trained professionals in order to receive their accreditation or licensing to practice in the U.S. And yet, many still are victims of racism and other prejudices from their patients who question their skill and expertise.
If they were working with white patients, often the white patient would not respect their authority and would ask them to go find the real doctor. There was another example of a physician who was working with Black patients, and the Black patients were judging his level of medical knowledge and saying, oh, you're from this land of snake charmers, and do you actually know what you're doing? And so I think that these physicians often from all sides would experience these questions around their competence and their ability to do the work, which is, competence is coded for, it's a very racist kind of idea here.
That's Iram Alam, Associate Professor of History of Science at Harvard University and author of The Care of Foreigners: How Immigrant Physicians Changed U.S. Healthcare. The number of immigrant doctors in the U.S. is 1 in 4. However, the ratio can be much higher in areas of the country where there are physician shortages. In rural hospitals, for example, it's possible for 100% of physicians to be immigrants. But regardless of the biases they face, these professionals work around it to give their patients the best care possible.
Some of that meant just kind of absorbing it. Other times it meant figuring out different strategies for how they would speak to people or address the patients. And often what it meant was just that over time, there was a recognition that this was the only physician that was available to people. And so there was almost a, what are you going to do? It's either this or nothing.
Although some patients may choose to do nothing, Alam says more often than not, most choose to see the foreign specialist.
It's a really complicated dynamic, especially because having an encounter with a physician is such an intimate encounter. It's such a vulnerable kind of encounter. So in some ways, I think that I'm not sure if it makes it worse or if it makes it less bad in that way. Like you're coming from a place of actually really requiring this care and being vulnerable to it as well. So I think it takes time. I think it's taken persistence on the part of immigrant physicians and their presence and having to prove themselves and having to prove their competence often. But, on their part, it feels like it's the conditions of their legal entry in the United States. And also, I think, a commitment to the profession and a commitment to providing care.
The U.S. government has a long history of recruiting foreign doctors to staff what are called Health Professional Shortage Areas, or HPSAs. The practice started at the end of World War II and has continued ever since.
Health profession shortage areas are these designations that the federal government makes where there are fewer than one physician for 3,500 people who live in those areas. And these designations can be all over. So they can be in rural communities, they can be in urban centers, but it just means that there's an inadequate number of physicians to the populations. So these often are areas that are impoverished, under-resourced, and they're not attractive places that U.S. trained physicians would like to go and work because the conditions they're difficult to work in.
Immigrant doctors who are here on a J-1 visa have to return to their home country for at least 2 years after completing their training. To bypass this requirement, they can choose to work full-time in an HPSA, medically underserved area, or medically underserved population for at least 3 years. However, Alan believes that this practice of recruiting foreign doctors is simply putting a bandage on a bigger problem. She believes medical students should be cultivated from rural or underserved areas in the hopes that they'll return to serve their home communities. Otherwise, there's no incentive for doctors to want to practice there. Alam says another factor in these shortage areas is the cost of medical school.
One of the reasons why I chose not to go to medical school and to go to PhD school was I didn't come from a wealthy family. And the idea of taking on that much debt was too overwhelming. And so what happens then is you end up getting these shortages. Also, it's shortage of specialties. So things like internal medicine, family medicine, pediatrics, the specialties that are not as lucrative are the ones that immigrant physicians are often trained in, or are sent to go and receive training in, because US trained physicians, they want to work in specialties where they can get paid more, so they can also pay off their debt faster and not be in these excruciating kinds of, cycles of educational debt.
Medical school in the US can cost upwards of $300,000. It makes sense that newly minted doctors would want to go into the most lucrative specialties and practice in the most affluent areas possible in order to pay off their debt. Allen believes the healthcare systems in Canada and the United Kingdom provide a more judicial model that tends to limit doctor shortages to some degree.
Physicians are salaried government employees, part of the national healthcare system. And so the ways that they are asked to move and work, and that work is organized, and of course they still have shortages and are dealing with similar kinds of issues, but the distribution of how people are organized is different than it is in the United States, where it's really based on a much more, it's a free market logic, and the ways that people are compensated is based on their geographic proximity to other practitioners. That's how insurance allocates reimbursements. This is not going to incentivize people to go and work in rural areas, or under-resourced hospitals in urban areas at all. For US trained physicians, for immigrant physicians, that's what's available to them. And so they end up going there.
And though these physicians are working where no one else is willing to, they still face blatant prejudice. Thankfully, Allen says celebrity doctors such as Abraham Verghese have helped to dispel some of the implicit biases some American patients have toward immigrant doctors. However, it's possible that these physicians won't be able to continue this custom. The current immigration policies have created pretty big obstacles for international medical graduates. Visa delays could drastically impact America's workforce and, in turn, worsen many Americans' access to healthcare.
These physicians and immigrant nurses and other kinds of care workers in long-term care facilities are so vitally important to the functioning of the US healthcare system, and the kinds of erratic and xenophobic immigration policies that are being enacted right now are going to have a very adverse effect on the health of the US population.
Allen's book, The Care of Foreigners: How Immigrant Physicians Changed US Healthcare, is available now for pre-order. You can find more information about Iram Allen and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.